A call from the State Department, this doesn't leave the room, here's what's happening.
You described it the intense media rush, and I never really put it into words like that, but that was exactly how I would describe the last 2 months. It was unlike anything I've ever experienced in my lifetime. It was nearly 24/7. You would get paged at 4 in the morning when Al Jazeera wanted to talk to one of your experts. It was weekends, it was nights, it was non-stop. A circumstance that we had the unit since 2005. We knew it was there. We were constantly drilling in it. You know, not only were the medical professionals drilling in it, but we were shooting photos. We were taking video. We had a pretty good working knowledge of the unit, and so having that there familiarized us with the unit, and so we had content already prepared when the actual event happened. So we had an impromptu press conference with doctors in the unit, brought the media up there, really kind of informed the population, at least locally, that this was a possibility. They knew it could be happening. They knew what it was all about. They knew maybe it wasn't as scary as they thought. So that was really important early on, as was the development of the call-in line that the folks at the health department staff.
Yeah, and we called it the Ebola information line because we didn't want to make it a hotline. This wasn't an emergency. It wasn't a crisis. It was obviously a very high-profile event because we had national media around us. As Taylor knows too well, I mean, I got a call from them or a text for you over the weekend about whether or not we wanted to open up the call center. But we did open up the call center, and we worked with the Nebraska Medical Center, and we worked with the Department of Health and Human Services, taking questions from the CDC's FAQs, and added some local elements to that. And we all worked together to vet them to make sure that we knew everything that we thought people would ask. And we set up a call center downstairs at the Health Department at 41st and Pacific. Certain items were questions we felt comfortable answering. Some questions we asked them how they would want it answered, and we presented it that way. According to Nebraska medicine, this is what you should do in that. Other questions, sometimes we just take notes, and I would contact Taylor and answer them, because we weren't going to speak for them, but we're all coordinating. Most of the egos are pretty much set aside. We wanted to get the correct information out to the public, because people hear Ebola and they think, what movie was it, Outbreak or whatever. And it just doesn't spread quite that easily. So we wanted to make sure that people had the facts, provide considerable assistance in getting out the information. But it's, there's a lot of misinformation out there and sensationalization to try and fight.
We had to develop a call-in number, like Phil said, and that was an invaluable help. Some of the other things that we set up before the first press conference, we started thinking about how can media access this. We had to develop a call-in number so reporters could call in and listen to the press conference. And I will let you know that even though we did do this, the complaints we received were just amazing to me, because it's not easy to coordinate everything that you're doing, and so I can't hear the interview, I can't hear what they're saying, please identify yourself. So that was something you had to start adjusting on the fly as you went on. You had to say, okay, make sure you identify yourself so that people on the phone don't get angry at us, because they were a very angry bunch, and I think they had like pitchforks and torches. It seemed like they were the most disgruntled group of media, I think. Another thing we developed as we went on was we started to utilize a Ustream to stream all of our events live, whether it be just almost an impromptu gathering of local media talking to one of our experts or doctors or nurses, or whether it was an actual press conference. We'd set up a webcam, open up the laptop, make sure we have a strong Wi-Fi signal, and that was incredibly invaluable. MSNBC used sound bites from one of our nurses for the better part of a week. After we streamed an interview with her, Fox News took an interview with Dr. Rupp, one of our infectious disease doctors, live as the stream went out. And that was actually facilitated by the fact that we had a pretty strong running contact list of everyone who was interested in hearing about the Ebola issue. That started on day one, was building the contact list. If you want to know what's going on with our patients or anything we have to say about the issue, we have this list. And I think today, we have about 300 people on that list, and if we were to send something else out, it would go out to all 300 people. So they were, all the national news media were on the list, international news media were on the list, and so that was really invaluable in updating the contact list from day to day, making sure everyone was accounted for who wanted to get that information. As we continued, the regular updates were really important. Feeding the beast, we talked about that, and giving that information out. How much information do they want to hear? How often do they want to hear it? And we found out early on we hardly could feed them enough. It was hourly that they would like to have updates. And you could get a sense from the phone calls you started to get early in the day. You'd see what the questions were, and you'd start to think, okay, here's what we need to focus on today. When the Dallas nursing issue came up, I said, well, we need to get some nurses out there because we have, you know, not just the public, but we have nurses across the country who are concerned about this. So we really had to decide how the cycle was, it was almost generated a life of its own. We had, especially early on with the first patient, daily updates, hourly updates, then daily updates, and then by the time we had a second patient, it wasn't quite as frequent, so we maybe went to every other day or something like that. You could just kind of get a feel for how much the information was wanted out there by the questions you would receive.
The other thing was we also wanted to be totally transparent in everything that was going on. You know, we let people know in advance where the guy was coming, how he was going to be transported. There was nothing left to people's imagination.
We tried to control as much as we could on the campus, but there, the concern was they saw people in personal protective equipment and people who didn't have it on. And the strange thing was, they were shooting from such a distance that it looked like everyone was standing really close together. And so the people who weren't in the personal protective equipment were 20 feet away from the patient getting put into the ambulance. So we had to diffuse that situation a little bit. We had a few calls about that and some concerns from TV stations, viewers had seen that. So in being more transparent, you had to be ready to answer something like that. And that wasn't an issue with the first patient because you came in to off it in under cover of darkness. They understand the need to be out in front of the issue, to provide as much information as you can, because in this age, social media gets that information out there more quickly than you can ever account for it. So instead of trying to hold information back, we were as forthcoming as we could possibly be. The one exception to that was what kind of drug was being used on the first patient. There was a confidentiality agreement that had been signed with the manufacturer of the drug. And so they were hesitant to announce anything about it. We couldn't say what it was. And there was a faction of people who were investors in these drugs that really want to know information about what drug is going to be used. That's another thing I'd never experienced before, but they were a vocal minority on social media about that. There were a few issues with the State Department that we had to keep internal until a certain time. When the patient takes off, where the patient is in the transport process, those were a few of the things from the State Department that we wanted to make sure that they were okay with us releasing. Pretty much every other issue, we kind of drove the bus on those things. I can't tell you how valuable it was to have doctors, nurses, and staff who understood how important it was to share daily updates, to share regular updates, to be in front of this and make themselves available. Because that was one thing I started to worry about into the second patient was burnout of all the media coverage of our professionals, because they were doing a lot of interviews.
Proper precautions and understand what was being done without causing needless alarm. That seems to be a kind of a concern, because we had the talk show hosts out there trying to make a great deal of excitement about it. Some were far more responsible than the others.
Right.
And Taylor got to visit with them a few times on the air.
Yeah, Tom Becca was excellent, actually. He came to almost all of our press conferences, all of our updates. He was there listening to the actual story. I think he was the only radio talk show host who showed a really vested interest in this. The other guys just kind of seemed to be interested in stirring up the issue on the air. And I can't tell you how often, I think Phil, you told me, oh, they're saying crazy stuff on KFAB. And so I'd call in, and just to provide a voice of reason. They were always pretty complimentary of what we were doing, but they just like to stir the pot a little bit.
I'd like to say also, one of the challenges is you're dealing with reporters who I think are generally bright people, well-intended, but they don't deal with science every day. And that makes it a real challenge to try and help them to understand things, because you started hearing questions about, what if this goes airborne? Well, other than the fact that viruses don't change the way they're transmitted, it never has, that's probably not going to happen.
Yeah, that was one thing that we started monitoring early on when we had the prospect of getting a patient in August. The social media started to light up a little bit, local Facebook pages, you had the people who weren't as informed as others, and so we took that opportunity to really jump on those pages, branded as Nebraska Medical Center, and put out the factual information about the disease. Already we had a lot of good information out there, but there was some misinformation, so we wanted to make sure our voice was in the conversation, and so we jumped around from from website to website, Facebook page to Facebook page, and Twitter, providing the information that was factual and accurate, and making sure that the tinfoil hat wearers weren't the majority. So,
and the day we opened the call center, we started putting out more and more information on Twitter and monitoring Facebook, which I'm on all the time monitoring that anyway, but we also had Hootsuite up monitoring everything that was going on, and what we found was if there was some information out there, it generally self-corrected itself on Twitter for the most part.
I also had a running tally of all the interview requests, and so each day I would write the date down, here are all the requests that we have, here are the future requests, here's what's out there, here's what's important, here's what's not important. You don't like to say not important, but you have to kind of look at these requests and see what can you realistically do and what's important for you to do. So you get any of the major networks, or the Wall Street Journal or the Washington Post or the New York Times, you know how you kind of triage things. The thing you have to realize is, and especially with someone like Dr. Smith, who is not too social media savvy, I had to teach him how to use his iPhone, which I thought was kind of funny. The guy's curing Ebola, and I get to help him with his iPhone. Kind of a proud moment. He's not as aware of all the online news sources. Now, if he hears New York Times, he hears Washington Post, he jumps to attention. He's ready to help out on those. If he hears other ones that he's not familiar with, like Dr. Oz, which happened. The funny thing was Dr. Hewlett, who was a good deal younger than him, said, "I know who she is. Who he is. We should do that one." So we're still trying to work that out. But you definitely do have to make a list of the ones you need to get to, and definitely not excluding anyone local, because they've been there the entire time. And so you cannot have NBC show up at your front door and Kate Snow come here, and you can't turn away everyone else you've always dealt with, because those are the people that you have the good relationships with. And so we were really cognizant of continuing to honor the local requests while getting to as many national and international requests as we could. Anytime we got inquiries that regarded anything along the lines of the CDC or the State Department, we would give them the contact information that we had for those folks. As far as how responsive they were, I'm not sure. I did get a sense of how responsive the media, or how responsive some of the folks were at Emory and Dallas from some of the national folks who'd been in all of the locations, and the answer was not very. From what we heard, it was kind of a different situation in dealing with the folks down there. And for whatever reason, I don't know why that would be, but that's how it was apparently. Yeah, there was one story that we had nothing to do with, and it showed up on Fox News's website, but it wasn't authored by Fox News. It was a website called the Daily Call, I believe. And for whatever reason, they chose, I don't know if you saw that, they chose to say that our hospital was understaffed because of Obamacare and staff cuts that happened 2 or 3 years ago. And that was completely unrelated. That had anything to do with the bio-containment unit today. It was completely not factual, not accurate in any way. It wasn't anything we talked to anyone about. So I'm not sure where that came from. But when I talked to my contacts at Fox News, that you all of a sudden have great contacts after something like this. They took it off their website immediately. We used Hootsuite, Google Alerts, and Universal Information Services is one that we use a lot. We got a lot of emails from other media monitoring services wanting us to check out their product, and ones that were pretty nice. So we are looking at some other stuff too, but we did a lot of that on all the social media and trying to be as responsive as possible. That was another thing that was interesting, is you can't respond to everyone. You could, but it'd be a full-time job. There are some things that just don't have any kind of relevance. You don't really respond to the faction of people who are investors in these drugs. I learned it's not good to get into shouting matches with those folks on Twitter. It really doesn't get you anywhere. So,
yeah, media monitoring is just something I do constantly.
We're pretty vigilant as far as that goes in letting our employees know that the message comes from the appropriate personnel. So we've had issues in the past where we'll see people pop up on social media saying something that shouldn't be said, doing something that shouldn't be done, and so we're able to spot those pretty quickly. Of course, you don't know about the ones you don't know about, but we didn't hear about a lot of that, much of that at all, actually.
And we did make an effort, I know you guys did, we did, to let our employees know that this was going to be happening, told them in advance, so they wouldn't wake up and look at the morning news and say, oh, this is coming. So that they wouldn't, also so they would be able to answer questions if they got it, because we have people at the health department who go out and do inspections at restaurants. We have people in our epidemiology section who go out and do contact tracing for diseases all the time. And they were the folks we put on the phones because they're familiar with disease, how disease is spread, what's involved in contact tracing. They're used to talking to people about somebody who has a serious disease.